Welcome, I'm really glad you're here. I'm Medicare Mary, a Medicare information specialist. Today we're going to make Medicare simple. Really simple. Whether you're turning 65 this year, already on Medicare, or helping a loved one figure it all out, this video's for you. Let's get started. Are you turning 65 in 2026? If you've been seeing Medicare ads everywhere and feeling overwhelmed, you're not alone. Medicare can feel confusing at first, and honestly, there's a lot of noise out there. But here's the thing, choosing the wrong coverage, or missing an enrollment deadline, can cost you real money. Even lifetime penalties. That's why I'm here. Today I'm walking you through Parts A, B, C, and D in plain language. By the end of this video, you'll feel a lot more confident about your Medicare choices. I promise. Quick note before we dive in. Everything in this video is for educational purposes only. Medicare costs and rules change each year, so always verify the latest at medicare.gov. If you need personalized help, talk to a licensed Medicare counselor or call 1-800-Medicare. Alright, let's get into it. So what exactly is Medicare? Medicare is a federal health insurance program created in 1965 to help Americans get the care they need. It's primarily for people 65 and older, but it also covers some folks under 65 with certain disabilities, and people with end-stage renal disease, which is permanent kidney failure. Medicare's run by the Centers for Medicare and Medicaid Services, part of the federal government. Think of it as your health coverage foundation as you move into your senior years. Medicare has 4 main parts, let me walk you through them quickly. Part A covers hospital care. If you're admitted to the hospital, that's Part A. Part B covers medical care, doctor visits, outpatient services, preventive care. Part C is Medicare Advantage, a private insurance option that bundles A and B together, and usually includes drug coverage too. And Part D covers prescription drugs. Together, these 4 parts give you comprehensive coverage. We'll go through each one right now. Let's start with Part A, hospital insurance. Part A covers inpatient hospital stays. So if you're admitted overnight, Part A's got you. It also covers skilled nursing facility care, but only after a qualifying hospital stay of at least 3 days. And it covers hospice care, some home health services, and inpatient mental health care. Part A's really your safety net for serious situations that need hospital-level care. Now let's talk about what Part A actually costs in 2026. Here's the good news, most people pay $0 a month for Part A. No monthly premium. You qualify for that if you or your spouse worked and paid Medicare taxes for at least 10 years. There is a deductible though. In 2026, it's $1,676 per benefit period, and a benefit period starts when you're admitted to the hospital. Now, it's important to know what Part A doesn't cover. It doesn't cover long-term nursing home care. And it doesn't cover dental, vision, or hearing. We'll talk about how to fill those gaps in a bit. Now let's look at Part B, medical insurance. Part B covers your everyday medical needs. Doctor visits, specialist appointments, outpatient services. Preventive care like your annual wellness visit, screenings, and vaccines. It also covers durable medical equipment, wheelchairs, walkers, oxygen equipment, and mental health services. Part B's the part you'll probably use most often. It's your coverage for staying healthy and managing ongoing conditions. So what does Part B cost in 2026? The standard monthly premium is $185. If your income's higher, you might pay a bit more, that's called IRMAA. There's also an annual deductible of $257. You pay that once a year before Medicare starts sharing costs. After the deductible, Medicare pays 80% of approved costs, and you cover the remaining 20%. That 20% can add up fast, especially for major care. That's why a lot of people choose a Medigap plan, also called a Medicare supplement, to help cover that gap. Part B's required for most Medicare plans, so it's a key piece of your coverage. Now let's talk about Part C, Medicare Advantage. Medicare Advantage is a private insurance alternative to original Medicare. Instead of getting coverage directly from the government, you get it through a private insurer that Medicare's approved. It replaces Parts A and B, all-in-one coverage. Most plans include Part D drug coverage, and many add extras like dental, vision, and hearing, things original Medicare doesn't cover. The catch is you'll typically need to use the plan's network of doctors and hospitals. It can be a great fit for the right person, but you really want to do your homework first. Before you pick a Medicare Advantage plan, here are the things you need to check. First, are your doctors in the plan's network? If they're not, you could pay a lot more or need to find new doctors. Second, are your prescriptions on the plan's formulary? That's the covered drug list. Third, you still pay your Part B premium of $185 a month, even with Medicare Advantage. Fourth, plans vary by county, so compare your options every year. And one more thing, switching back to original Medicare from Medicare Advantage can make it hard to get a Medigap plan later. Take your time. Compare before you commit. Now let's cover Part D, prescription drug coverage. Part D helps pay for your medications. It's separate from Parts A and B. Every Part D plan has its own drug list, called a formulary. Check that your medications are on it before you enroll. Plans work at participating pharmacies, and premiums, deductibles, and copays vary by plan. Here's something really important: if you delay enrolling in Part D and don't have other creditable drug coverage, you could face a lifetime late enrollment penalty. Don't skip Part D, even if you don't take many medications right now. 2026 brings some really exciting changes to Part D, and these are genuinely great news. The biggest one? There's now a $2,000 out-of-pocket cap on prescription drug costs. Once you've hit $2,000 on covered drugs in a year, you pay nothing more for the rest of the year. That's huge. The deductible's up to $590 for 2026. There's also a new monthly payment option so you can spread drug costs throughout the year instead of paying big amounts all at once. And insulin's capped at $35 a month per covered drug. These changes can save you real money. One of the most important things about Medicare is knowing when you can enroll. There are 3 main windows. The initial enrollment period, your IEP, is a 7-month window around your 65th birthday. It starts 3 months before your birthday month, includes your birthday month, and ends 3 months after. The annual enrollment period, AEP, runs October 15th through December 7th every year. That's when you can change your plan for the coming year. And the special enrollment period, SEP, kicks in when you have a qualifying life event, like losing employer coverage or moving. Please don't miss your initial enrollment period. Missing it can mean lifetime penalties you'll pay every single month. Let's go through some common Medicare mistakes, and how to avoid them. Mistake 1, missing your initial enrollment period. That can mean lifetime penalties on your Part B and Part D premiums. Mistake 2, not reviewing your plan every year. Plans change. Your needs change. Always check during AEP. Mistake 3, ignoring your drug formulary. Your medications might not be covered, or might cost more, on a different plan. Mistake 4, not checking if your doctors are in network. Mistake 5, assuming Medicare covers everything. It doesn't cover dental, vision, or hearing. And mistake 6, not signing up for Part B when you retire, even if you're still working. Knowing these can save you a lot of money and stress. Quick question, is this video helpful? If it is, drop the word helpful in the comments. I'd love to know it made a difference. Are you turning 65 in 2026? Tell me below, I read every comment. And if you have Medicare questions, ask them. I'm here to help. If this helped you, please give it a thumbs up, it helps other people find this information when they need it. And if you haven't subscribed yet, hit that subscribe button and the bell so you never miss a new video. Thanks so much for watching. You don't have to figure Medicare out alone. Here's what I want you to take away: Medicare doesn't have to be overwhelming. When you understand it, you can feel confident. That's why I'm here. That's why I created this channel. I'm Medicare Mary, your Medicare information specialist. Subscribe to Medicare Mary, Medicare Made Simple, so you always have a trusted resource for your questions. If you need help, visit Medicare.gov, call 1-800-MEDICARE, or find a free SHIP counselor in your area. Thank you so much for being here today. Take care, and I'll see you in the next video.